And actually, this could be one right now. If you're listening to the podcast, just put down everything else and just listen and what I call think with time in mind. And so living in the now, we've turned over our attention like it doesn't have any value. We're doom scrolling on our phones, we're watching too much TV or doing something else. We have given it away, but our attention should be considered a luxury good. So if you have a nice watch, or if you have a nice car, if you have a nice handbag, you treat it well, or you should treat it well. Yeah. But you do not treat your attention like that.
It's true.
Those little alerts, those little red things on your phone, oh my God, you have to return that text message. You have to return that email. Turn it off. Give yourself a break and live in the now.
Welcome back to another BIOS KOL Sessions. Today we are daring to be vital with Dr. Allan Mishra. Thank you so much for being here. It's quite an honor for me.
Well, thank you very much for having me.
Yeah, absolutely. Let's just get right into it. You know, how did you go from being a PRP pioneer, orthopedic surgeon, to really starting this movement around vitality?
It's actually connected to PRP. So about 6 or 7 years ago, I got invited to give a talk in Hong Kong about PRP and regenerative medicine, and it was in the middle of July. In fact, the talk was actually on my birthday.
Wow.
So I said to my family, hey, do you want to come with me? And my wife said, well, it's about 100 degrees and 100% humidity in Hong Kong in July. I'm not going. So we diverted to a long time planned or interested vacation to Australia. And one of the check boxes for me was to go scuba diving in the Great Barrier Reef. And there's a little town called Port Douglas in the northeastern part of Australia. And it's got a 4-mile beach. And this beach is awesome. And I had finished my checkbox scuba diving in the Great Barrier Reef. I used to be a runner, and I was running on the beach. It's like the Chariots of Fire thing was spinning in my head. And just in my swim trunks, and I would run down the beach about 2 miles, take a little swim in the coral sea, come back, and I'm standing underneath this 80-foot tall palm tree. And I looked out, my phone wasn't working very well. I'd been on vacation for a week or 10 days. I was gonna go on my way to this awesome meeting in Hong Kong. I'm like, I feel vital. Yeah. I literally, it was like something out of the movie, like Inception.
It clicked.
Well, this epiphany happened.
Gotcha.
And I said, I'm gonna figure out what that word means. What does vitality mean? And I had this envisioned, I'm gonna find a biomarker. Because we know a lot about blood and blood products. And I was like, I'm gonna find a biomarker for vitality. But it is traced back to a specific moment. And that was like a pivot. I needed to figure it out. And that's where it happened on 4 Mile Beach in northeastern Australia.
Wow, that's awesome. And how does vitality differ from maybe words like wellness or recovery? Because I feel like you have a different definition that's pretty specific.
Yeah, it's taken me years of exploration, and that's why I call my Substack Vitality Explorers. And I think it's traced to that time. I was exploring what it means. I'm still exploring what it means. So I don't have all the answers. And our world is filled with these just little nuggets of information that are popping up. And I try to every single week read 5 to 10 articles about this spectrum of things that are connected to our well-being. To answer your question specifically, I have a working definition for vitality. It's still working, but it is purposeful, energetic, and connected living. And I chose all those words on purpose, literally, no pun intended. We need to know why we're here on the planet. We need to I'm trying to bring as much energy as possible to your podcast today, because it's an honor to be on your podcast. I want to reach as many people and say, if you can lead a vital life, you may not know when your last best day will be, but I want to lead the best possible life I can for as long as I can. And so that's the final one, is what brings me to the connection. And so you and I have known each other for years, right? And so being connected to somebody is not something that AI can define. I'm not sure we can measure it, but there's maybe a vibe going on right now where it's valuable, right? And when we saw each other, I don't know when we first met each other, or how many times we've seen each other in different meetings, we are wired to want that. Yeah. So it's not connected directly to well-being or to longevity. And that's why I've embraced this idea of vitality as my endpoint. It's a little hard to explain because it's never going to be perfectly defined.
Yeah, and it feels like, to me, it's you want to be present in the moment,
100%.
Right? You want to be enjoying the moment. Not that longevity isn't important, but you're not thinking almost that far ahead in a way. You're really just in the now. Is that accurate?
Well, I love that phrase. I use that all the time, live in the now. And people say, well, how do I have a meaningful life? So I thought about that. And if you stack up a whole bunch of meaningful moments, and actually this could be one right now. If you're listening to the podcast, just put down everything else and just listen and what I call think with time in mind. And so living in the now, we've turned over our attention like it doesn't have any value. We're doom scrolling on our phones, we're watching too much TV or doing something else. We have given it away, but our attention should be considered a luxury good. So if you have a nice watch, or if you have a nice car, if you have a nice handbag, you treat it well, or you should treat it well. Yeah. But you do not treat your attention like that.
It's true.
Those little alerts, those little red things on your phone, oh my God, you have to return that text message. You have to return that email. Turn it off. Give yourself a break and live in the now.
And the dare to be vital phrase, to me, that feels kind of like a challenge, or you're like poking people like, hey, there's something better here for you. I'm daring you to do this. Is that how did that come up?
Well, it came up because I think a little because I'm an orthopedic surgeon, and I also believe that within each one of us, we have the power to be a better version of ourselves. Now, we don't always have agency over everything in our lives, but we have agency, which is the ability to change something in some part of our lives. We can either eat better, we can exercise more, we can connect better. Choose one thing that you are not good at and try to work on it. So this dare to be vital is more like, I'm challenging you. I'm not saying I'm going to give it to you. So when somebody says to me, how can I be more vital? And what I say to people is, I can't give it to you. Your mom can't give it to you. Your government can't give it to you. It is something, vitality is something you earn by taking ownership over your decisions and choices. And people kind of tilt their head at me like, what did he say? Yeah. And I said, you are in charge of your vitality. Yeah. Okay. And I have had lots of examples of people. A close friend of mine died of ALS a few years ago, and he taught me how to be vital, even in the context of dying from a horrible disease. Mm-hmm. He made a big difference in the ALS community. He made a big difference for his family. Made a big difference for his friends in how he dealt with that. And so I put him in the book that I have, which is called Dare to be Vital. Yeah. And I have a t-shirt where people look at me, and when I go to the gym, I have this Dare to be Vital t-shirt, and people are like, why do you wear that? I go, when I look in the mirror, I feel like I could maybe do a better workout. Yeah. So somebody said to me, I got to make it with backwards letters, so when you see it
you can see it.
So maybe you've inspired me. I got to make a backwards Dare to be Vital t-shirt.
What are the 4 pillars?
So this is actually something I thought was novel. And as doctors, we don't necessarily get enough time to study history and philosophy. Maybe you did, but so I had this, oh my God, it's your physical, mental, social, and spiritual well-being all connected. But that's just thousands and thousands of years old. But we've kind of forgotten about that. We, in Western medicine, spend all our time on either, in my parlance, surgeries or medications or injections, when the other things matter. Connection matters more than your blood pressure, smoking, or being overweight. If you can be a little bit more in control of your sleep and your diet and your exercise, your inflammatory markers are going to plummet. You don't need to take a Motrin, Advil, or Aleve. You can modulate some of your hyperactive sympathetic nervous system by simply how you breathe. So some of these things are within our power to make better, but they're all connected. And the social one's important too. And so if you and I have known each other, but we've had some good times together, right? So that adds to it in a way that we can't quantify, but it's okay to go with your buddies and do something. You don't want to give anything to excess. Sure. But if you spend more time, and we know for people who get really lonely or very socially disconnected, the best data is in cancer. Have you heard the mouse in the middle data?
No, I haven't.
Okay, this is a good story. So they did this cancer research, and they had these population of mice, and then one of the poor mouse got cancer, and then they had a whole bunch of his litter mates around him during the treatment phase, and then they had one in isolation. And the one in isolation did so much worse. They got the same cancer, got the same treatment, and so I forget where it was published, but I think it was in the paper, the mouse in the middle does better. And so oncologists know this by people who show up for their infusion therapies. If they come alone, they don't do as well. If they have 2 or 3 people with them, they're going to do better. So again, we can't quantify it, but we need to lean into it. We need to know that our our physical well-being is connected to our social well-being. It's connected also, obviously, to our mental health. And we need to take care of ourselves, give ourselves white space within our workspace. And the final thing I challenge people on the spiritual side is it can be a variety of different things, but here's what I suggest. You need to believe in something bigger than yourself. If you're only out for yourself, you will never be your most vital version. We are meant to help and serve other people. And when you do that, you're going to feel better. And actually, the data is crazy. Your markers go down. Your inflammatory markers go down.
Everything gets better.
And we can serve. You can serve people in a way. I can serve people in a way that could be just even taking care of a sick kid or a sick mother, or volunteering somewhere. But do a little time serving others, and you will lead a more vital life.
That's amazing. Now, how do you balance? Obviously, you're an orthopedic surgeon. You're very accomplished. You know, in order to get to those things, right, you have to have drive. You got to have goals. You got to have a strong work ethic.
Yep.
How do we balance accomplishing those things, but still being vital, right? Where you don't make it to those endpoints, but then you wake up one day and you're like, what did I do it all for?
I'm so lucky to have a lot of great people around me. I believe, I don't want to let people think that you shouldn't have to work really hard.
Yeah.
So there's this concept, it was started by the Duke women's basketball coach. I don't know if you've seen this, but it's a great story. You should look it up. There's a little thing on YouTube. And she said, you guys are looking for the easy button, easy button or the easy bus.
Yeah.
And she said, it's not coming, because we are here to teach you how to do hard things well. Yeah. You were taught how to do hard things well. I was taught how to do hard things well. And guess what? As soon as you figure out how to do that, they give you something harder. Okay?
Yeah.
You learn how to do this case, you learn how to do that. So you level up to this idea of a high capacity person. Okay? Yeah. And I don't apologize about being a high capacity person anymore. I can get a lot of stuff done. But then I've had people along the way who are like, true story, I don't think I've ever told this story, but when I was in medical school, I just wanted to crush it. Okay? I was maniacal about doing really, really well. And I had two roommates. I mean, they were very good, but they were kind of jokesters. Yeah. They would hide my books. They would hide my book. You're going to the basketball game. You're going to play on the basketball team with us. And I'm like, where's my book? I got to do well. No, you can't go. Yeah. So they taught me the value of physical and social well-being. And then throughout my entire career, I've implanted things that have been helpful. I've stayed connected with my friends. In my mid-30s, I had no idea. I couldn't swim at all. Yeah. Okay, but unfortunately, my buddy who ended up dying of ALS later, he said, look, we're gonna do a triathlon. I go, dude, I'm a good runner, I'm a good cyclist, but I can't swim more than 200 meters in a pool. And he said, you come to my class. I said, that's a master's level swim class. He beat me up for 8 months, and I did my first triathlon. And then we did triathlons together, 3-4 per year for a decade. I had no idea between mid-30s and maybe mid-40s how valuable that would be to maintain my physical and mental well-being. So I'd go on a long bike ride, I'd go on a long run, or I'd had my buddy here who leveled me up to a mediocre triathlete. Okay? But
you're in there.
Yeah, I completed all these things, and I had no idea that would be meaningful to help me get through the hard times.
Sure.
So we need friends that are going to bring us along. We need to commit to doing things for our physical, mental, social, and spiritual well-being. And here's the hard part. Maybe people don't want to hear this. You got to take ownership over it. You cannot be a victim. I'm sorry, there's a lot of things that bad to happen to a lot of people, but that doesn't help you. I mean, get some help if you need it, work through it, dust off your boots, get back up and see what you can do to help yourself. Because in general, those are the people who are going to be more vital. Does that make sense?
Absolutely.
This is like, I think there's some, I mean, again, I'm an orthopedic surgeon. I'm not some philosopher or something like that. But there's some logic to this argument. And what's interesting now is what's happening is it's coming right back into our world of regenerative medicine. So if you want to optimize your PRP or optimize your bone marrow concentrated procedure or your surgical procedure, if you are better going into that, you're going to have a better outcome. So it's good for the patient, it's good for the provider, and it's good for everybody because there's going to be less risk of a complication, faster recovery. But it gets back to this, what I call partnership. And I think we talked about this. You have this snarky question, right?
Sure.
Do you want to be treated well or optimally? And so the idea of optimal treatment in my world requires that the physician and the patient be partners. I promise you I'll bring my A game as much as I can. You got to bring yours. So I now hold people to account. And honestly, I thought I was going to go way down in my rankings or ratings because I was like, you need to take responsibility for your choices. Opposite has happened. People are asking us to be not like their daddy or their mean coach, but to say, listen, you shouldn't stay out late. You shouldn't eat the bag of Doritos and a 6-pack of beer before you have your procedure the night before.
Right.
Because you and I will look at the PRP and we're like, oh my God, look at that. That's really cloudy. I want to inject that back into you. It's full cholesterol.
Yeah.
Anyway, go on.
Well, do you feel that sometimes it's actually harder to take care of yourself than it is to take care of others?
100%.
Like I see where a lot of people, they're like, they go above and beyond for other people, their family members, their partners, their kids. But then for some reason, they can't put the same effort into themselves. What do you think is the block there?
Well, the block there is that we had, back to your point, is we spent a decade or longer not taking care of ourselves because we had to learn hard stuff.
Yeah.
We were in the hospital. We were learning how to operate. And the responsibility plus honor of having somebody put themselves in your hands, I think, is enormous. But as you move forward year after year or decade after decade, and if you've neglected yourself, you're not going to be the best person for your family or your patients. So it's shifted a little in the last year or two. Mm-hmm. And I have this first theory I had was vitality is a skill. It's like a first novel thought.
Yeah.
Okay? And so if it's a skill, then it can be learned, it can be taught. My second is vitality powers performance. What do I mean by that? If you're more vital in seeing your patients and taking care of them, you're going to do a better job. So we need to push pause. And I now give people like you, and I have to give myself this, permission to take my foot off the gas. Yeah. Okay, that doesn't mean you're not going to work hard, by the way. You got to work hard. If you want to be a high capacity person, you got to work hard. But then you say, it's okay to say no. It's okay I need to sleep a little bit more. I need to make sure that I see my friends or my family. Because it's back to that idea of time, and I've broken it down to like 8 different parameters, as you know, but time is your most valuable, non-renewable asset. So if we manage our time better, we have a higher chance of being vital.
I think you're kind of hitting on some of the points, but what is the Vitality Action Plan?
Yes, so this is
I love that.
Yeah, so I actually now, I put it into my patient's medical record. So starting about 6 months ago, I just took a chance. I was like, okay, am I going to put these weird phrases into their actual medical record? But I have a conversation with them, and I'll say, listen, here's what we're going to do, and this isn't your surgical plan, or this isn't your medical plan. And I think words matter, because I said, I want you to be as vital as possible. And anybody out there who's a doc, feel free to take this idea. Yeah. If you say, I want you to be as vital as possible, and I'm going to put your vitality action plan into your chart, and then you enumerate it, here's what you're going to do. Maybe you're going to send you to therapy, maybe we're going to do a procedure in 6 weeks, but I want you to eat better, I want you to sleep better, I want you to find 1 or 2 things in your life that you can do to reduce your stress. And then they come back to me and I go, yeah, I've done my vitality. And we talk about, should we talk about one of the things that zero cost way to improve your vitality is to be a matador? Yeah. Okay, so I have a idea of like if you sit up or stand up tall, pull your shoulder blades backward and downward, it actually helps your shoulders, but the data actually shows that it helps your brain. So if you're trying to solve difficult problems where we're looking at neuropsych testing, congruous versus incongruous things, your brain's ability to function is literally better if you're sitting or standing tall. And so what is that? It's a zero cost thing you can do yourself, because we're all hunched over looking at our tiny screens. Stand up 3 times a day, take some deep breaths, and be a matador. And people will remember that way better than if you and I could talk about why we should pull your rhomboids together, get your trapezius down, hold your, we can
activate the core.
Yeah, we could throw all this medical jargon at people, and then, or you can say, hey, look at a picture online of a matador and be a matador. And people get it. They're like, oh, hey, I'm a matador. So when I'm out in the wild now seeing my patients, that's what I call it. They'll walk by Safeway or somewhere out in I'm a matador. My wife looks at me, she goes, what is going on here? It's like this weird thing. But they actually, their posture is better. And I'm like, good.
That's awesome.
Yeah.
What do you think is the most often overlooked? So now you've been kind of measuring these markers of vitality. specifically for patients, what is typically the most overlooked thing? Is it the sleep, or where do you see it?
It's the social connection.
The social connection.
Especially after COVID, we lost it, right?
We
couldn't connect with anybody.
Yeah.
We had a core group of people that we might have been in a bubble with for a while. And I think we're in 2025 now here, we're emerging back into a world where there's a whole group of people who were really anxious about connecting.
Yeah.
They didn't see people in person. We need to lean into that.
Lean into the social. I think it's also important for the younger populations too, right? I think that's where a lot of the teenagers are having a lot of difficulties in connecting, socializing.
Yeah, they're just spending too much time on their phones. They're not spending time in real life.
Yeah.
They don't want to talk on their phones. They'll just text, right? So I think, and that's what we're doing a little bit here. Is I've been now doing a thing I call vital rounds. And what this is just a small group of people connecting in person without their phones with a single page agenda of questions that are meant to be provocative and learn about each other. One of the ones we recently did is human intuition in the age of AI.
Yeah.
So the data about ChatGPT is quite interesting. Very recently published data, and again, it's all on this Vitality Explorer Substack site. But I read this thing where if you're a college student and you were asked to do an essay, you were given 3 options: ChatGPT, Google, or your own brain. Okay, and they wired them up with the EEG so they could kind of see what was going on. And the people who were using ChatGPT, there were literally very few neural connections. People who used Google had more. The people who were using only their own brain had many more. And here's the kicker. They brought him back 24, maybe 48 hours later, and they asked him a couple questions. They said, hey, did this come from your essay or not? And the people who had the ChatGPT, it was like 85% couldn't even identify anything in their own essay. It was about 50-50 on the Google, and it was the flip. It was 85 could do it for their own. And what they also asked them is, what percentage ownership do you have over this? The same sort of numbers. So now this is only maybe 3 or 4 weeks ago. Yeah. It has changed how I use AI tools. So if I'm trying to put together something, I force myself to use my brain first. Mm-hmm. I'm not a Luddite. I love AI. I think it's amazing. It's going to change our world. But I use it not as a co-pilot or a primary thing, but something to help me in ways that it does a good job of. Like if it's a huge data set, if you want to check your spelling, if you want to get a great AI image, it does great on that. But I don't care if you're 18 or 80, use your own brain first. Otherwise, it's turning into mush. I think I put it out there, ChatGPT is unplugging your brain.
Yeah.
So we need to be aware of it because we can do things that they can't. You and I are doing it right now. I mean, we have a vibe going on that we can't define. Yeah. We have that same thing with our patients. If we bring our personal self to that moment, we're going to be able to uncover something. Maybe it's a piece of important data about how to take care of that patient. And if we don't continue to sort of train our human intuition, it's going to atrophy.
That's amazing. It can make us dumber a little bit.
100%.
Yeah,
and then all of a sudden the new generation of people coming out are going to be like, well, we're just talking to the AI, but the AI is an impersonal, algorithmic. Maybe it can pass 100% on the board exam, but it's not a human, and it's not going to be able. And I've worked with a lot of the companies in the Bay Area about trying to, put a technical wrap around human intuition. They can't do it. They have no idea.
Now, I think part of being vital, it doesn't mean that necessarily you're not going to have bad days or you're not going to have bad, experiences. I think part of being a physician and someone like you and I is what makes us good as part of being the empathetic process, right? Patients, they know that we're going to sit, we're going to listen, we're going to empathize. And, that's a transfer of energy that's happening, right? Mm-hmm. And a lot of times it can be difficult to unplug that when you go home or when a patient has a bad outcome, regardless whether, we did anything, there's bad outcomes, right? What are some strategies for physicians to kind of let go of that energy or deal with the burdens of complications and come home and still have a vital day?
It's such a great question because we're not perfect, right?
Yeah.
We can't get it all right all the time. I think all of us have structured our situation where we try to minimize our risk of making a mistake or complication. And as you said, you can do everything right, and then sometimes there's a problem, right? And it's a burden. It's back to what I don't know, maybe you and I had the same sort of training. If anything goes wrong, it's my fault until proven otherwise, right? So that's not necessarily the right answer, but that's what's ingrained in my head. And it's the hardest thing that I'm not very good at, letting it go. And talking about, this is another way you can improve your own vitality or your social connections, is learning about forgiveness, okay? You probably have an amazing memory, because doctors in general have a very good memory. Here's a telephone book, memorize it. Here's another telephone book.
Here's a test.
So we can unfortunately remember really too well sometimes, and trying to let go of if somebody else is, done something to you that you need to forgive them for, or the harder thing, if you know you did something wrong, maybe if it's really bad, you obviously should do your penance for it, right? But if you did an error of omission or something bad happened that wasn't directly related to your intention, you need to try. I'm no expert, okay?
Yeah.
But giving yourself this word called grace, which is like, it's okay. And I'm not good. I'm not good at this. I still suck at this, and I wish I could say. And if something doesn't go right, or I perseverate on it, I don't bring it home. Exercise for me is the best way for me to
release.
Kind of bring exhaustive exercise will snap something in my brain and go, I'm just too tired to be worried about it anymore, and it helps you sleep. So that's my out. It's hopefully a positive way to do it. But everybody's got to get to their area where they can let it go a little bit more. It's like, that famous Beatles song, Let It Be.
Let it be.
I have 2 or 3 different versions I've downloaded on my Spotify. There's some great covers of that are just awesome. So that's it. Let it be. Okay,
that's great. We're going to finish. I have to bring it up. I think we're coming on 20 years from your original PRP study. Just a short version on, how did that come about, and how have you seen the change in PRP therapy 20 years later?
Yeah, that's a great question. I think next year it's a 20-year anniversary of publishing it in American Journal of Sports Medicine. It was 2006. And so when you think about using a component of your own blood, one of the first surgeries I ever learned how to do was tennis elbow surgery. And it's a weird surgery where you open up the area around the elbow and you literally try to cause a little bleeding. So the very first time I did that procedure, I think you scratch up around something called the lateral epicondyle, and there's a little oozing of blood, and then you close it up. And more often than not, you would try to stop that bleeding. But in my head was this attending surgeon saying, no, don't worry about it. If it bleeds a little bit, it's going to heal better. Okay, so that was way back in my residency, my second year of residency. Come back, early 2000s, I came up with this idea of injecting a component of your own blood, because I thought, well, that's exactly what's happening inside the elbow. And it turns out I got lucky, because it's an isolated system. It's less complex than the shoulder. It took me 3 or 4 years to get that first data, and then we published another one 7 or 8 years later. I think we need better data, and we need to be really hardcore about solving smaller problems. So tennis elbow is a smaller problem than knee arthritis. It's way less complex. It's way less complex than shoulder problems. So we have a lot more work to do. And as I was talking about earlier today, I'm not the tip of the spear anymore. There's some crazy person out there who might have an idea about how to do it. And so this idea of, because when I was first doing this, people thought I was crazy. So if you have come up with a crazy new idea, one of 2 things is true. You either are crazy or you're way ahead of the game.
You're way ahead of the game.
So I happen to be way ahead of the game 20 years ago. And if I come up with something like this vitality stuff, which I've been doing 5 or 6 years ago, honestly, I was being ridiculed for what I was doing. I was being told that this is going nowhere. And I had deep intuition about, it's not maybe good for everybody, but it's good for me. And then it's just mushroomed into this, as you call it, it just makes my heart sing, a movement, right? So that's where it is now. And it's way different than PRP, but it's also augmenting that, which is really kind of fun.
Well, thank you for doing that. I mean, that was such a landmark study. It definitely changed, probably the trajectory of my career, to be honest with you. So thank you for doing that. We're going to finish with kind of some rapid fire fun stuff here.
Okay.
All
Stump the chump here.
Exactly. So what's one daily ritual you can't skip if you want to feel vital?
All right. Get ready. Cold shower.
Cold shower. All right. If vitality were a song, Which one best captures it for you?
Oh, wow. All right. Old school. I'm going to go eye of the tiger. Like I got to. I get in the ring every day.
I'm getting it right
yeah,
now.
I got to go eye of the tiger. Sorry.
All right, and last one. If you go back to 2006 when you were publishing that study, right before you published it, and whisper one vitality lesson to your younger self, what would it be?
Easy. Believe in yourself.
Believe in yourself. There you have it, folks. Believe in yourself. Allan, hey, thank you. This was awesome.
So much fun.
This was great. Hope you guys enjoyed it. Thank you for coming again. Until next time.